You have an MRI already. So why is your doctor ordering X-rays? I'm a spine surgeon. One of the biggest reasons for spinal problems is what we call instability. As the joints in the back of the spine wear out or see trauma, the vertebrae can slip forward and pinch off those nerves. Here's an example. This is an MRI or a side view where we can see the vertebrae are lined up nicely. There's some pinching off of the nerves in the back, but probably not enough to cause issues. Now here's an X-ray of the same patient standing up. It's obvious that the L4 and L5 vertebrae don't line up and are unstable. This is called a slip disc or a spondylolisthesis. When you're lying in an MRI scanner, that instability goes away and the spine lines up. When you stand up, like in these X-rays, the bone slips forward and those nerves in the back become pinched off. Most patients don't have symptoms when they're lying down or sitting down for this reason, so if I didn't get those X-rays, I wouldn't know how unstable the patient's vertebrae are. Here's a subtle signal on an MRI scan that most radiologists don't understand. Most radiologists will say that this is an inflammatory condition, that the joint has fluid in it because it's inflamed. That's not the case. It's because the joint itself is actually spread wide open. So on the lateral view here and on the axial view, or looking down the pipe of the spine, you can see that there's what we call facet diastasis or liquid in that joint because of instability. Here's the fix. I put a spacer between the L4 and L5 vertebra with what's called a lateral interbody fusion or an X-lift procedure. I restored the space between those two vertebrae and I opened the spinal canal again and locked it in place with screws and rods just like this. If you imagine the spine without those screws and rods, those vertebrae now line up perfectly like a normal spine. A lot of my patients fear the word spinal fusion, like in this case. This patient's problem was too much motion at the L4-5 segment, so I needed to take that away. Fusion was the only reasonable treatment for this patient, and I wouldn't have known just how unstable he was if I didn't take those X-rays in my clinic. He's now very happy, his spine is stable, his nerves are wide open, and he walks pretty much an unlimited distance.